My name is Melanie Niblick, and I went to Dr. Brady at TSC for intermittent shoulder pain. I actually had an injury back in February and realized that there was a little bit more to it than just the regular wear and tear from being a dancer. We did the MRI in March, and Dr. Brady had actually kind of called it before we even went in for the MRI. He said, "Oh, I think you have a slap tear," and I did, along with a few other things that we found in the process. And I probably would have been okay with the rotator cuff damage without the surgery, but because I had the slap tear, there's really nothing you can do. I mean, it has to be fixed. Considering that I had, 50 students depending on me to get them through this performance, I was worried that I wouldn't be, I really was thinking, how can I put this off, knowing that those kids depended on me to make it through the end of May. We decided to go with cortisone treatments, which we did a couple of treatments in the shoulder, and it worked. I received the shots in March, and I was great. About that third week of May, I went back in to follow up, and I was getting a little sore. The shot was wearing off. My performances were somewhere around the 20th. 3 days later, I was on the operating table. He timed it perfectly, knowing that I had my business to think about. He got in there and fixed it, and I was in and out of, I was in there for a couple of hours, and just if you've ever had any other type of day surgery, it's pretty much the same thing, except you wake up and you feel like you're in a straitjacket. Other than that, it's pretty normal. This first 6 weeks was not a walk in the park. It was very, very difficult. Sleeping was a big problem. When you're, like everybody else, you're used to sleeping in a bed, and you have to adjust to sleeping in a chair, upright. I had to learn how to wash my hair and, take a shower, and just the day-to-day stuff becomes a lot more difficult with one arm, especially when you're right-handed and suddenly you're having to use your left hand for everything. 12 weeks out, you feel a little bit more human. And then 18 weeks out, you're starting to feel like, okay, this is okay. Once I got my range of motion back, that was huge, because at that point, honestly, as a dancer, I had some issues with, I was very nervous about being able to do my job, not only as a mom, but as a dancer. Is this ever going to get better? This hurts. I cannot tell you how thankful and how grateful I am that we did it when we did.